Welcome to our general survey lesson. This is going to be lesson 1 of our assessment module. The purpose of this video is to provide you with real-world nursing education that goes beyond this Nurse Workbook 2.0. So why the nursing assessment? Why is there this huge chapter on it? Why is it a class in nursing school? Why do we care so much? The nursing assessment is our foundation to nursing. This is going to help us understand our patient, what their needs are, and what their potential needs are going to be in the future. But additionally, not only do we need to know what's going on with our patient, but we're going to be constantly doing so many interventions with them, no matter what kind of nursing we get into, that we're going to be always reassessing our patient and seeing, did this intervention work? What's not working? And are there other things that we can be doing? So we have to lay this groundwork down first and go to the very basic. So if you are a first-year nursing student and this assessment process is not natural for you, one of the biggest rules of thumb is getting a systematic nursing assessment. So this means every time you approach your patient, you want to do this in a systematic way. As a travel nurse of over a decade, it did not matter what hospital I walked into. It didn't matter that I didn't know the doctors or the supply rooms or any of the equipment, because I wasn't worried about my patient care because it was so ingrained in my systematic approach. So let's get into this. So there are two types of data that we're gonna accumulate from our patient. And our first one is gonna be that subjective data. This is gonna be what your patient is verbally saying to you. This is gonna be what they're feeling, what the patient's experiencing, and it's their personal perspective of their feelings and their environment. And we're gonna ask open-ended questions. So one thing that's important about our subjective data is it's what the patient's telling us. Some of our patients can downplay their symptoms, and some of our patients can overplay their symptoms. So this is why it's important for us to be asking the appropriate questions. Instead of asking, does your stomach hurt? We wanna ask things like, tell me about your stomach pain. And our other type of data we're going to accumulate is our objective data. So this is going to be what is tangible and measurable. We're going to think of this as the information that's gathered or observed by medical tools, our lab results, our MRI results, CT scan results. This is not going to be our patient feels hot. This is going to be our patient's temperature is 101.4. So what is the general survey, its nicknames, and why is this important? So the general survey has multiple nicknames. You can hear this as the across the room assessment or your from the door assessment. And this is all going to be dependent upon your preceptor, your nursing school, and your hospital. But just know that when they're talking about that general survey, what you're first hearing and seeing from your patient and the subjective and objective data, they're meaning this. This is your general survey. We can gather so much more information by looking at them as a whole. This general survey can be done when they're being walked or wheeled into the hospital, or potentially they're coming to triage. We can gather information just by observing them, and that's going to kind of guide us into what the focus of our assessment should be. By focus, we mean where are those problem areas? If they're complaining about that stomach pain, we can go ahead and focus there. But we don't want to not follow our systematic approach, and we're going to continue getting into this. So what are our 3 categories of this general survey, this across the room assessment? The first one is our appearance. So how does our patient look overall? Does it look like our patient's overall hygiene is well kept? Do they have any cuts and bruises? And what is the physical appearance telling us? So we can have patients that walk in through our door, or maybe we're walking into their patient room and they look very disheveled. They look like they haven't showered. Potentially they don't have a home. Or we can have a patient that maybe just got in from a business trip. They look very well kept, very well together. And we're just kind of observing overall. Our patients that don't have a potential home definitely don't have the best access to care. So we're going to think in the back of our brain that they could have multiple things going on. Whereas our person that's super clean kept, we can always think about how they probably are brushing their teeth, taking these showers, keeping themselves clean, and might have a better health situation than our other person. And our second category is going to be our overall behavior. So what is their mood? What is their emotions and their interactions? What's that overall mental status that we're being greeted with? For example, if we see confusion in our elderly patient, that might not be as concerning as a 27-year-old that has confusion. So of course, confusion is never going to be something that we want to see, but we do know that this can be a natural part of aging in life. So if our 90-year-old patient has some baseline confusion and they're not really sure where they are, but they know their name, we're not going to be as worried as we'd be if we see a 25-year-old sitting in the bed and can't tell us what their birthday or their name is. And we're also going to gather information by looking at the mobility. So this is if they have any devices that they use. Is there a cane or a walker present? What is their potential injury, or how is their overall strength? So again, as this patient is walking or this patient is just even going to sit into a chair, we can really just see so much by just watching them as they're mobily moving on. So now that we just looked at our across the room assessment, or this from the door assessment, or this general survey, we want to get into the most important part. And this is going to be our vital signs and our neuro exam. And if there's one thing that I want to leave you with in this entire lesson, is that your vital signs and your neuro assessment will not lie. So you'll know how fast you need to take care of a patient by getting this information. So the first thing we're going to do is achieve these vital signs. This is going to be getting that temperature, what is their pulse or the heart rate, their respiration rate, how fast they're breathing per minute, their blood pressure, their oxygen saturation, and of course, asking them how much pain they're in. We're going to go over every single one of these in future lessons as well, to the very basic level. And being the efficient nurses that we are, while we're getting these vital signs, we can always move into our neuro exam. So the neurological assessment combined with vital signs gives us an immediate snapshot of a patient's brain health and their overall stability. It is crucial to nail this down at first, as this can be a flag of a serious issue right off the bat. So ensuring that we're right on the track before diving into this detailed physical assessment. So we're going to keep summarizing and keep drilling in this systematic approach. We've done our across the room assessment. We saw what we've gathered from just looking at this patient. We're collecting our vital signs, and now time to check out their neuro exam on a basic level. We're going to go a lot deeper into a detailed neuro exam as well in our neurology module. So first, we're going to be checking out their LOC. This is their level of consciousness. So we're able to determine this level of consciousness quickly by doing a point scale. There is a maximum of 3 points to this. And every question we ask, they're going to get a point if they get it right. And if they get it wrong, we're not going to give them a point at all. So 1 point is going to be given if they're able to answer who they are. And this is being oriented to person. 1 point will be given if they can answer where they are. And this is going to be oriented to place. And 1 point will be given if they're able to answer the current date and time. This is going to be oriented to time. So we're going to do some practice questions below here. Our patient is oriented to the day and the environment. This is going to be 2. And in our next one, this patient is oriented to the wrong last name only. So this means they answered the other ones right, but they got their last name wrong. And this is going to be a 2. In our next example, this patient is oriented to name, time, but their wrong place. So this is another 2. Our next one, our patient is oriented to the hospital and their first name, but it doesn't tell us if they're oriented to time. We can assume this is a 2. And in this one, our patient's oriented to wrong name, wrong time, but the right place. There is a 1. And lastly, our patient is oriented to day, name, and where they are. This is going to be a 3. So if you are receiving a report from an EMT, or maybe you're overhearing this in the hospital, oftentimes you're going to hear someone say this patient is A&O times whatever the number is. So in these examples, in this last one, our patient would be A&O times 3, meaning they answered their name, time, and place correctly. So we're going to keep going with more of a detailed neuro assessment. We're going to look at our patient's pupil size and their reactivity to light. And we also have an entire pupil assessment lesson in our neurology module. So this is going to be looking for the size and shape of our pupils in addition to the response to light, and this is known as accommodation. We're also going to be testing their motor function, and this is going to be observing their overall strength. We're going to be looking at their movement and also the symmetry. So is one arm stronger than the other? Is one leg weaker or limping than the other one? Our next test is looking at our sensory function. This is going to be our touch, our pain sensation, our temperature, and our vibration. So we could do this numerous ways where we can just go ahead and touch our patient on all their extremities. We can take our pen tip and push our little pokey side into them to see if they sense that. And also the temperature. Do they feel cool or hot in any of their extremities or overall body? And lastly, we're going to also look at their reflexes. And this is an involuntary muscle response to specific stimuli. We can do this by hitting our hammer up to our patient's patella and looking for that reflex. And we're going to be going over the entire reflex block in a future lesson here in our assessment module. And once we've performed all of this, what is going to be the next step of the nursing assessment process? This is going to be the physical assessment, aka our head to toe assessment. And our next lessons are going to be covering everything from our head to toe assessment. So I will see you in the next lesson.